Hello, this is video 2 of the paid feeding assistant training course, and we're going to go over different feeding techniques in this video series. So the first thing I want to talk about is preparing for meals. The comfort of the resident is important during the meal service. The setting should be free of unpleasant sights, sounds, and odors. So if someone's TV is on really loud and it's going to interrupt your ability to have a conversation with them, we want to turn that down. If we've just changed a brief or something, there's a bad odor in the room, we want to get rid of all those odors before someone eats. Residents should be properly prepared. They need to have their oral care and elimination needs met. Persons who are incontinent should be clean and dry. Residents with dentures, eyeglasses, and hearing aids should have these devices in place before the meal. To increase mealtime enjoyment and comfort, unnecessary equipment should be removed from the room. Make sure the resident is in a comfortable position to eat. Before preparing a person for your meal, you should obtain the following information from the nurse. So we want to know how much assistance the person needs with eating. So some people may be on a restorative plan, or they may be able to do it until they get tired. So we want to encourage as much independence as possible, but we also need to be able to provide assistance when they're needed. We want to know where the person is supposed to eat. Do they normally eat in the dining room, or do they eat in their room? How the resident is to be positioned. We'll talk about positioning a little bit more. If the resident wears hearing aids or eyeglasses, and how the resident gets to the dining area. So if they were eating in the dining room, are they in a wheelchair? Do they need assistance? Can they self-ambulate? And then if the person uses a wheelchair, walker, or a cane. So all of that we would need to know before preparing a person for a meal. So serving meal trays. Meal trays are served after residents are prepared for their meals. Trays should be served promptly. They have containers that keep hot food hot and cold food cold. OBRA guidelines require that food be served at the desired temperature when the resident receives it. Serve trays in the order assigned by the health team. Residents seated at the same table are served at the same time. So if you think about it from the perspective, have you ever been out to a restaurant and they bring everybody's food but yours? It's uncomfortable. Everyone's eating, everyone's enjoying themselves, and you're just kind of left there all alone. So we always want to serve everyone at the table at the same time. If a tray is not served within 15 minutes, the appropriate discipline should check the temperature of the food, and if it's not an appropriate temperature, another tray will have to be obtained. Some facilities allow reheating of hot foods in a microwave oven. We typically do not do that at Nazareth Home. We would just get a new tray for that person. So on this tray, you can kind of see different things to keep the food hot and cold. So these are insulated dishes. It's going to keep their coffee hot. It's going to keep their salad cold. And then these are heated trays to hold the plate to keep those hot as well. So before serving meal trays, you need to obtain the following information from the nurse. We need to know what equipment for adaptation does the resident use, and we talked about that in that first video. So adaptive equipment, do they have a divided plate? Do they have a weighted fork? We need to know what they need so that they can eat appropriately. How much help does the resident need with opening cartons, cutting food, buttering bread, etc.? So if they are completely dependent on you, or if they can do some things themselves. So we need to know what kind of appropriate help we need to give. If the resident's intake measured, and is the resident on a calorie count. So we're still going to almost always document their intake. We want to make sure that we're documenting how much fluid they have and how much food they've eaten within a percentage amount, and then as close to the milliliters that we can for fluids. And if a resident's on a calorie count, then we need to keep that in mind as well, because we're going to need to turn in how much they ate so that we can keep track of that. So feeding a resident. Weakness, paralysis, casts, confusion, and other limitations can make self-feeding difficult. Frequently, these residents are fed by staff. Foods and fluids should be served according to the preference of the resident. Offer fluids during the meal. Fluids assist the person to chew and swallow. Spoons may need to be used because they are less likely to cause injury. The spoon should be only 1/3 full. This portion is chewed and swallowed easily. Some residents require smaller portions. Some residents who require feeding are angry, humiliated, they're embarrassed, If you think about it from their perspective, if you were in a car accident and you broke both your arms and you were unable to feed yourself, it's a very helpless feeling. You would also maybe feel angry, humiliated, or embarrassed if somebody had to help you eat. They feel the same way. So some display depression, some are resentful, some refuse to eat. So we let them do as much as possible for themselves. Some of them can manage finger foods like bread, cookies, and crackers, but need more assistance with the utensils. So we just want to make sure that we're letting them be as independent as possible. If the resident is strong enough, we're going to let them hold their own milk or juice, but we always want to make sure that we're testing that before we give them any hot liquids. We want to be aware of any food or fluid restrictions. We're going to provide support when it's needed and encourage them to try, even if food is spilled when they're trying. Residents who have visual impairment are more aware of food aromas. They may know the food that's being served before you tell them what it is, but the food on the tray should be explained to the resident. So when feeding someone who's visually impaired, we want to tell them what we're offering them before we put it in their mouth. And for the ones who feed themselves, we just need to describe the food and fluid arrangement on the tray. So like in this little picture down here, you can see, you could say at 1 o'clock is the baked potato. At 4 o'clock is your carrots, so that you could tell them and describe to them so that they can then be as independent as possible. Many residents prefer to pray before a meal, so we want to allow them time and privacy to do that, and that shows respect and caring about the resident. Meals are an opportunity for social interaction. We talked about that a little bit in that first video. It's a way that they can have contact with others. So we want to engage residents with pleasant conversation, but we want to allow them time to chew and swallow as well. So we don't want to take up all of their time with them telling us a big story and then us not be able to provide nourishment for them, but we also want to keep them engaged as much as possible. So we always want to sit in a way where we're facing the resident. That helps with our dementia residents, that helps with our hard of hearing residents. They can see your mouth, they can see your body language. Sitting is more relaxing for you, and it shows that you're taking the time out to devote to that person. When you stand, you're communicating this nonverbal sense of hurry that you don't have time, you just want to get this over with. So we always want to sit and face the resident whenever we're feeding them. You can also better see how they're eating if you're sitting and facing them, and that would be a better way for us to see if they had any swallowing issues. I can't express this enough. This is not a time for you to be on your cell phone doing anything private. This is a complete time for you to be engaged with the resident. So you shouldn't have cell phones out anyway, but we're not going to feed them a bite and then get on our phone while they're chewing it. We want to be involved and engaged with that resident. So someone with dementia, feeding techniques. Dementia is the progressive deterioration of mental function. Persons with a diagnosis of dementia can become distracted while eating. It's hard for them to sit still long enough to eat an entire meal. Others forget what the knife, fork, and spoon are used for. Some resist efforts to assist them while eating. A confused resident could throw or spit food if they were confused. So you need to be patient. A quiet and calm dining area is helpful. Special meal times can also be helpful. Confused resident may eat small amounts more often than 3 times a day. So they may sort of throughout the day have small little snacks to maintain them instead of being able to sit still and eat a full meal. You want to talk to the nurse if you have feelings of impatience or upset. Remember, each resident has the right to be treated with respect and dignity. So we're going to treat them in the most dignified way possible. So someone who has dementia, before we feed them, we need to know a lot of information. Why does the resident need help? How much help do they need? Can they do finger foods on their own? Are there any activity limitations? Are there any dietary restrictions? Any signs of choking or aspirating? What size portion should the resident be fed? Should we do a 1/3 spoonful? Do they need less than that? What observations need to be reported and recorded? The amount and kind of food that's eaten, and if they have any complaints of nausea. Positioning. So correct positioning is one of the most important requirements for safe and comfortable dining. A resident who's not positioned correctly will be uncomfortable and unable to fully enjoy their meal and is at a high risk for choking or aspiration. So the correct position for dining is head held forward with chin down slightly. So you can kind of see this lady here. She's head held forward, chin's down a little bit. Her trunk is completely upright, her hips are bent 90 degrees, and her knees and ankles are 90 degrees, or as close as possible. If you look down here at this picture, you'll see this person's in semi-Fowler's, which is 30 to 45 degrees. That would be the absolute lowest you could go, and really I'd like them even higher than that. This is Fowler's position, but if they couldn't tolerate any higher than that, we may put some pillows back behind their neck just to get them up a little bit more, because we want gravity to help us so that they can swallow. It's important to check for correct positioning before you start to assist a resident with a meal. Residents with special physical problems can be a challenge, so if they have contractures or something like that, positioning can be a little bit more difficult. So you want to make sure that the nurse or the CNA has positioned them appropriately before you ever start feeding them. So if you go into a room and someone's laying flat, you need to go get the aide to help you position them appropriately. Hand over hand is a very helpful feeding technique, and it's exactly how it sounds. You place your hands over the resident's hands and you complete the task together. You want to sit on the same side as the hand you are assisting. If your right hand is over the resident's right hand, sit on the resident's right side. Sometimes the technique serves as a prompt for the resident to complete the task on their own. In other cases, the resident knows what to do, but is unable to because of weakness or other physical problems. So using hand over hand for these individuals helps preserve or improve their self-feeding ability. Participating even in this limited way promotes a better sense of independence than being passively fed. So these are some really good opportunities when hand over hand would be helpful. So if someone couldn't lift their own utensils, you could put your hand over their hand and lift together. If they can't cut their own food, they're unable to pour beverages, just take their hand with yours and you're gonna do it together. They can't actually stab the food with a fork. Instead of you just doing that for them, put your hand over theirs and do it together. Unable to spread toppings on food like jelly on toast, that's what they're doing over here. Or they're too tired to self-feed as the day progresses, or they've forgotten how to eat. Another technique is cueing. Cueing is when you give a verbal prompt for the resident to do something. So you say something to get the resident back on track. So an example of cueing would be to remind the resident to take a bite of your chicken, or say, would you like another bite of potatoes? Because maybe they've sort of stopped eating and sort of wandered off. You want to make sure that you're getting them reoriented back to feeding. And then quality of life, we always make sure before we ever enter a resident's room, we're knocking, we're going to address them by their name, and we're going to introduce ourselves. That's the right thing to do. So pre-procedure. This is everything we need to do before we go to feed someone. We want to explain the procedure. So I'm going to knock on the door. I'm going to come in, introduce myself. Hello, Mrs. Jones. My name is Laura Cartwright. I'm a feeding assistant, and I'm here to help you eat lunch. That's going to let them know I know who they are, they know who I am, why I'm there, and what I'm going to be doing. I want to show them that I'm practicing good hand washing hygiene. So I'm going to go in and I'm going to let them see me do that. That gives them a sense of cleanliness, and I know that I'm doing the right thing as well. I want to ensure the resident is in a good sitting position, a safe sitting position, and then ensure good placement of the dietary tray. So if they're in their wheelchair, we want to make sure that the bedside tray is as close as possible. If they're in bed, we want to get it up and as near them as possible. So the actual procedure of feeding someone. We identify the resident, check their dietary card, and we address that resident by their name. Some residents may require a napkin be draped across their chest, under their chin, or a clothing protector. And we want to explain the food and fluids on the tray to them so that they know what they're getting. Prepare the food for eating, so we're going to season the food for them, take all the lids off of everything. We're going to serve food in the order that the resident prefers, and we're going to offer fluids in between solids. We're going to use a spoon for safety, and we're not going to rush. We want to allow time for the resident to chew and swallow. Use straw for liquids if the resident is unable to drink from a glass or cup, and we want to use one straw for each different liquid. You wouldn't want a straw in your milk and then in your orange juice, so we're going to do the same thing. You can also provide short straws for individuals who are unable to tolerate the taller ones. You want to talk with the resident in a pleasant manner. We want to encourage them to eat as much as possible, encourage them to wipe their mouth with a napkin, and we'll assist them if necessary. record how much and which foods were eaten, measure and record intake if required, and then we take the tray away when it's finished. Once it's all over, we're going to provide for the comfort and safety of the resident. So we're going to place the overbed table in reach of the resident, make sure their bed's in the lowest position, ask if they need anything, and put their call light within reach. We're going to wash our hands again, and then we're going to go tell the nurse what the intake was so that it can be documented.